Welcome, everyone. If you're just coming into the room, we're going to give just a minute for everyone to come into the Zoom room and settle, and then we'll get started in just a minute. Okay, I will go ahead and kick us off, Kimi. For any of you who do not know me, I am Allie Williams. I'm the head of school at the Pilot School, and I have the privilege of working pretty regularly with Dr. Kimi Winklespect, who is leading this parent series. We're at series number 5 of 6. So some of you have been with us for all of the other sessions so far. Some of you are just joining us for the first time. This is right in the middle of the ADHD portion of our parent series. The faculty at Pilot have gotten a chance to work with Kimi all year long on management strategies, behavior management strategies for working with students with ADHD, and it has been absolutely rewarding. We see Kimi every 2 weeks and have really gotten a chance to kind of try strategies out, bring back feedback, and work together as a group. And it's just been a really rewarding experience. And so, so I can speak from from a faculty standpoint that these behavior strategies really are effective and so helpful in just kind of understanding and managing and living with children with ADHD. So I'm going to turn it over to Kimi, and you can get us going. Kimi came right from work without a minute of spare time. So I'm giving you a moment to breathe, and then she'll kick us off. Janet and I will be kind of looming in the background. I'm going to turn my camera off, but I'll keep an eye on the chat and Q&A. So Dr. Kimi Winklespect, thank you so much for all of you here. And Kimi, go ahead.
Absolutely, that sounds good. And I appreciate the warm welcome, and it is nice to be back as always. I enjoy working with you all, and then these parent webinars are one of my favorite things. So we get to continue talking about one of my favorite topics. As you mentioned, I've been working with the school and the teachers and staff all year related to behavior management for ADHD. So I'm excited to share that a little bit with you all this evening. So this is the second in a 2-part series on ADHD. So we talked about understanding ADHD in February. And today we're going to think about the treatment piece, the behavior management piece. So I will share my screen and then we will get started. For those of you who know me or those who have not been here before, I really enjoy interaction. So if there are questions that come up, if there are things that you really want to know about that you're not sure I'm going to cover, or it makes sense to ask that question, the likelihood that other people have that same question is pretty good. So make sure to put it in the chat box or the Q&A, and we will be monitoring that and then answer those as we go along. And it makes sense to kind of do that. But I'll stop a little bit at some natural junctures to make sure that we have a time for questions as well. I'm sure that everybody who joined for a reason. And so I want to make sure that we can tailor it to your questions as much as we can. So we're going to focus on the behavior management piece, so ADHD treatment. So goals for tonight. Understanding the treatment guidelines for ADHD. So we're going to do a quick review through the American Academy of Pediatrics guidelines for the treatment of ADHD and talk a little bit about what those are, what's the development process for those, and then how do those translate to what we're going to cover this evening. We're going to talk through how behavior management fits into the comprehensive picture of treatment for ADHD. So where's the place or the kind of niche for behavior management, and how does that fit with all we know about ADHD and how it might be helpful for certain things. We're going to understand what makes behavioral intervention successful for kids with ADHD. So we're going to talk through what is this behavioral parent training roadmap, so to speak. And so really think through what are the core pieces, and then give you a little snippet, kind of a snapshot of each one of these pieces so that you have some take-home tips for that. And then lastly, increase awareness of other resources. So there's a lot of resources about ADHD out there. I won't say that all of them are good. I'm pretty picky about ADHD resources, and so I'll give you my top few that would help to kind of increase knowledge and education if you're interested in learning a little bit more. So how to use this information. Tonight's presentation is educational in nature. So information that we'll talk about tonight should not be substitute for treatment from a healthcare provider. So that if you feel that your child might need some therapy service, you might like to do a parent behavior management course, that's awesome, right? We kind of got you excited about it tonight, and we certainly have some resources for that. But this webinar is not sufficient for them kind of guiding you through all of those principles. So make sure that you get that support if it's needed. This is not rocket science. So this is not information that you have not heard before, probably in some form or fashion, especially if you're parenting a child with ADHD. But the techniques that we're going to talk about this evening have to be used properly, consistently, and with an understanding of ADHD in mind for the best results. Each child's different, so some of the strategies that we'll talk about work better for certain kids than other kids. And these are, again, what's commonly in a menu when you would look for parent behavior training. Those of you who know me know that I am really fiercely an advocate for evidence-based training. And so if you were going to receive evidence-based treatment and parent behavior management for ADHD, it should contain these elements in some form or fashion. Behavioral treatment does not cure ADHD, so it's not going to be something that ameliorates all of the symptoms that you're seeing, but it certainly helps to manage and treat the symptoms effectively in different settings. So key concepts for parenting ADHD kids and teens. And these are just some anchors for us to think about as we kind of dive in a little bit more to the behavior management principles. So ADHD is the most common childhood mental health diagnosis. So you're not alone as parents. I think sometimes it really feels like that when you're in that day-to-day struggle and trying to really think through, what can I do about this? How can I remind my child to do this for the 17th time? You're not alone. So parents that parent kids with ADHD are out there in right, all the places that you probably typically interact with individuals at school, you know, at your daycares, all of these different places. ADHD is a neurobiological condition. And I say that so that we can really think about the focus on biology. So this is not a willful set of behaviors. So there are true structural brain differences in kids and teens with ADHD and adults, right? Kids and teens and adults with ADHD and without ADHD. And most of that's activity in the prefrontal cortex. So this part, your front part of your brain here, and the amount of activation that your brain has in that time period. Your prefrontal cortex really helps you to control a lot of those planful behaviors, impulsive behaviors, that's both emotion and behavior, and your ability to kind of organize and really kind of get through attending to detail day to day. So ADHD is not a willful set of behaviors done intentionally by the child. So if you've gone through an accurate, and thorough diagnostic process, ADHD is a condition that, again, has a biological basis. And though it feels a lot of times like these are willful things, and again, don't get me wrong, all kids do things that are willful. So I certainly won't go on record as saying, there's not a willful thing that your child's doing when they're kind of not listening or paying attention to one of these directions. But the total of symptoms in the diagnosis is not a willful, intentional set of behaviors that children are doing. Keeping in mind a disability framework for parenting kids and teens with ADHD is really, really important. And so anticipating and being prepared to provide more support than you would anticipate for a child without ADHD. So being prepared that this is going to be more work, that this is going to take additional patience, that this is going to be something that you need to anticipate and provide additional supports, I think can be really helpful. Because we know that kids with ADHD are going to need extra help and structure to manage symptoms and learn helpful habits. We know that. And so let's not be surprised by that as a parent. So if you're parenting a kid or teen with ADHD, let's anticipate that this is going to happen. I think things feel a lot better. Not that they're less work, but I think it feels like proactive, kind of productive, a little bit more planful work sometimes when you anticipate that and kind of be prepared for that challenge versus when it kind of sneaks up on you. ADHD is a diagnosis that continues throughout a lifetime. So again, if that's accurately diagnosed in the first place, this is not a diagnosis that we would anticipate is going to go away over the course of your life as you go into adulthood. Symptoms change. So we certainly know that symptom trajectories and the things that kids struggle with over the course of development change. So that younger kids struggle more with hyperactive impulsive behavior commonly, and middle school to high schoolers really start to struggle more with those organizational challenges because we don't expect younger kids to organize a lot. So sometimes those attention and inattention features really become more challenging in kind of that middle upper division if we're thinking about, pilot, but then as we go into kind of high school, middle school, and college as well. ADHD can be successfully treated and managed. So we know the good news is that ADHD has actually been around a long time. So it's one of the oldest childhood diagnoses. In the original DSM, it's called hyperkinetic childhood disorder of childhood. So it actually has been around the longest, one of 8, right, original childhood diagnoses. And we have lots of research starting in about 1980. The research about ADHD in children, kind of childhood disorders in general, really started to explode. And we've learned lots since 1980 about ways that we can successfully treat and manage ADHD. So I'm excited to share a little bit about that with you all tonight. So we'll do a quick review of the American Academy of Pediatrics guidelines for the treatment of ADHD. So for preschoolers, so up to your 6th birthday, so that can include some kindergartners, treatment should start with evidence-based parent training and behavior management programs. So this could be either group or individually delivered. In their initial statement about this, they actually said that it should be group. Group behavior management is sometimes a little bit more challenging to find. So group or individual behavior management and school consultation. So we should really kind of push in a lot of intervention is what they're saying for our youngest kids with ADHD to see if we can change and modify a lot of the challenges, like the classroom kind of situation, the kind of parent dynamics that are going on that are making it challenging, some of the difficult behaviors that oftentimes younger kids experience. And we should push in intervention before we try anything else. So medication should be considered a second-line treatment. So if the other interventions fail, so if we've done good school consultation, we've got a course of parent behavior management, we're still seeing challenges continue that are significantly disruptive and impairing, then medication would be considered as a second-line treatment. For elementary and middle schoolers, so our 6 years to 11-year-olds, medication intervention in combination with behavioral parent training, and then classroom behavioral intervention supports or educational supports. So that could be learning and that could be kind of classroom accommodations, both in there. So we know that the combination of behavioral intervention and consultation with the school and medication intervention are what's important for success. Behavioral treatment should also be implemented with the family and the school. So consultation, communication, the more that all systems can kind of use the same principles and agree on what are the kind of target behaviors and the things that they're kind of seeing and doing to intervene with the child, the better results that you're going to see. The more collaboration and cooperation, those sound very similar. So the more collaboration and cooperation, the better the outcomes are. For adolescents, so our 12 to 18-year-olds, so our kind of end as we're probably thinking about 6th grade, then all the way up into start of college. Medication intervention along with evidence-based training interventions for teens and families and school supports are also important. So the framework for this evidence-based intervention changes a little bit. So parent behavior interventions are still really important, but we do incorporate work with teens and a lot more collaboration in this age range. So first, for specific skill development, so we think about organizational skills training, kind of social skills training. There are very specific drivers training programs and drivers preparation programs that really help kids with ADHD understand kind of rules for the road and how to practice those and manage attention appropriately, as we could all understand that that would be a really important task. One of the big fears I think that parents have for kids with ADHD. What we also know is that collaborating with teenagers, so instead of saying, hey, here are the things that you need to do in the morning, and we're kind of dictating that to them, that collaborating with teenagers, as is the case with helping to manage them in a lot of different ways from a parenting perspective is important, that it gets better return on your investment in terms of parent behavior management. And so you, parents and kids, are going to kind of work with a therapist together to kind of collaborate on goals, to understand ADHD together, to talk about these things. And again, that child participation is more limited and a lot more variable in terms of what the results are with that prior to age 12. So we definitely want to incorporate, again, our older kids and teens into this intervention very actively, so that they're aware, educated, and can help to participate in the intervention fully. Any questions about this before we kind of go over behavior management, kind of what's helpful and limitations? Any surprises in there from anyone? Okay. So how's behavior management helpful? So as a psychologist, I don't prescribe any medication. I would not be doing my job well if I didn't tell you that it's an effective treatment for ADHD. It would be irresponsible for me to not talk about that. I do all the other things, that are not medication management. And it certainly has its benefits, but it has some limitations as well. So benefits of behavior management, it's really helpful for unmedicated ADHD and non-medicated times of the day. So again, the large majority of classes of medication for ADHD are not necessarily 24-hour acting. So they're more short-term medications in large part. And so there are always going to be times like homework time, bedtime, after school unpacking, sports time, those types of things, activities after school, taekwondo, that all could occur during unmedicated times. So the behavior management skills are really helpful for unmedicated ADHD times. Building skills to manage symptoms more successfully. So it really helps. So the medication kind of puts you in the right framework, right? It helps your brain to be kind of firing and cooperating, so to speak, to then really help you benefit and maximize learning some of these skills. So it helps you to build skills. So if I'm paying attention really well, but I still don't remember what's required to go to language arts class, and I need to use a checklist to help me remember that, the medication helps me to be in the right mind frame to remember, oh, I've got this checklist and I need to use it. But it doesn't necessarily create the checklist for you. So this behavior management program and organizational skills training, things like that, build skills to help manage symptoms more successfully. How are you going to manage a tantrum? A medication might make it less likely that you have a tantrum. It's not going to tell you what do you do in the moment to then figure out how to resolve this successfully. It's also effective to manage conditions that might co-occur. So if we think about oppositional defiant disorder, that's something that co-occurs with ADHD pretty commonly, or conduct disorder, so other behavioral conditions. We also know that behavior management principles can be highly effective for anxiety and depression. So those internalizing things, especially in our younger kids that come along sometimes with ADHD, right? So if you do tend to get a lot of corrections or negative feedback or redirection, sometimes kids are sensitive to that and start to get anxious in different situations or kind of a little sad about that. And these parent behavior management techniques can be helpful for that as well. Limitations of behavior management intervention, on a whole, it's not as effective as medication. So study after study after study proves that the overall benefit of a behavior management intervention is not as effective as the overall benefit of a medication intervention. It requires intensive effort on the part of parents and schools. So both parents and schools really have to, I call it kind of being in it to win it. So you really have to kind of think about what are these strategies and be all in to really embrace them, think about them, and be open to changing and modifying and thinking about how they work and feedback. And it takes a lot of effort to do that. As Dr. Williams mentioned, I've been working with Pilot all year, and we started in kind of a November educational morning, right, to really kind of learn and dig in about some of these strategies. And we've been doing a lunch and learn series throughout the school year to really think about what do these principles look like and how can we apply them to the classroom. But it's been a lot of intensive effort in education, and then really good thought that kind of goes into that each time that we meet, where we think about, okay, what works, what doesn't necessarily work, how do we kind of need to think about these things. But again, that's a lot of effort, and it's a lot of consistent effort, and so that can be difficult. So let's think about the behavior management roadmap. So what are we going to talk about? So when we talk about parent behavior management or effective behavior management training or evidence-based parent training, all of those things are really descriptors for the principles that you see in front of you here. So this behavior management roadmap really has pretty unique steps. And we are going to think about these steps in a certain order as well. So like, I'm not going to jump to timeout. So I wrote these in a particular order because I'm never going to start with timeout as a way to manage ADHD behavioral challenges. So I'm going to reserve that for the end. We'll talk a little bit about why, but I think that's also surprising sometimes because we're thinking about the amount of challenging or disruptive behavior that you're managing. And the first thing that sometimes we're thinking about is a consequence. What happens is if consequences are overused, which we know is the case with kids who have a lot more negative behavior, which sometimes occurs in kids with ADHD, that it loses all of its effectiveness. And so we want to really use that at the last, after we've used these other tools to help us to kind of manage more challenging behavior, like the most challenging behavior, successfully. So the effectiveness of these behavior management techniques is decreased if we don't use them in the right order, with frequency and with consistency. So again, that intensive effort that we're talking about, we have to do these in a certain way. They build on each other in a certain way, and we use them frequently and consistently to see optimal results. So steps to an effective behavior management program. So the first part of this, which you're going to think about, is called special time. That's probably the technique that I would teach every parent, regardless of whether children have ADHD or not. We know that it really helps to kind of treat some of the symptoms of disruptive behavior disorders like ADHD, but we also know that it's an amazing technique to build relationships between parents and kids. And so it's a universal. All of these techniques, as well as we're kind of thinking about them, I would encourage you not to really just think about them for the child with ADHD. That you think about implementing these overall as a strategy in your family system to really work to kind of increase some of those positive relationships and increase success. All kids actually have things that they need to work on. I also think that sometimes it's a nice contrast when you implement the skills with different kids in your family who have different strengths and weaknesses, because some things work pretty well with one child and not necessarily with the other child, but it gives you a good sample of ways that you can kind of see response to behavior. And it helps you, I think, actually have a little bit more confidence in using the skills, because you'll see different results and different progress in different kids. So we'll think about this concept called special time. So daily one-on-one time, we were working to really build that positive time and relationship. We'll think about differential reinforcement and praise, and we're going to dive into each of these skills a little bit together. So labeled praise, and then kind of the other part of this, which is ignoring. So I'm going to give my attention in very specific, deliberate ways, and I'm also going to reduce my attention in deliberate ways as well to help us get more effective responses in terms of behavior. Reward programs, incentives, response cost programs. So they could be called different things for different ages, but basically we want to incorporate a reward system. We want to help kids to realize that if they put in hard effort to change some of these behaviors, because again, that's what we're doing with ADHD. These are not skills that kids naturally have, that kids, they're not coming home and thinking like, I wonder what I have to do when I get home. I'll have to unpack this, I'll have to take out my water bottle, then I'll get my homework out, and then I'll be ready to kind of play, right? You drop your stuff and you run out. So we're going to have to provide some of that structure. And we're also going to have to provide an incentive to say, hey, if you spend some time taking a few minutes to do these things and remembering to go through this list, then you can kind of have a return for your investment to help increase their likelihood that they're going to build some of these skills, because building skills is tough. So providing a reward can really help to build some of that motivation. And then we're going to think about timeout and privilege removal. So there is a place for right consequences, and we'll talk about that at the end. We're also going to talk a little bit about ways to set yourself up for success. And so what could we do to address and enhance kind of progress and head off battles? We'll think a little bit about routines. So the more that we can use a consistent sleep routine, daily schedules, checklists, visual reminders, even timers. Some kids actually really enjoy functioning on a timer because it feels like everything's kind of a challenge and a race. Some kids feel the opposite, right? That's one of those that I think can go either way. But we'll think a little bit about how we can head off some of the battles by having a very consistent structure and some supports and prompts and reminders in place, because we know that kids are going to need those for daily routine tasks. I think the more that I work with kids and parents with ADHD over 15 plus years of being a psychologist, the most challenging behavior, I think, and symptom of ADHD that parents hear, this forgetfulness and daily routine. So the things that you do every single day, and the forgetfulness in that, like remembering to brush your teeth, remembering to, put your shoes on before you kind of come down, stairs, or remembering to kind of get your backpack before you run out to the car, like those types of things. Those are the things that really tend to be frustrating for parents because they happen every single day. So we'll talk about some ways that we can build in prompts for that. So why not talk about organizational skills training? I'll just head this discussion off. So we're going to talk about a lot of effective behavior management techniques tonight. Organizational skills training is definitely effective, but it requires a solid behavior management base to increase its effectiveness. So if I gave, your child a checklist and said, hey, utilize this, but there wasn't necessarily a reinforcement or reward, they didn't really know how to use it, I don't think they'd actually be any more likely to be successful. So that we have to really understand this firm foundation of behavior management to be successful with a lot of those other organizational skills training interventions as well. So we'll save that for a different time. So the principle that anchors all behavior management, if we think about it, this is kind of the core principle. One of my favorite principles in all of psychology is the attention principle. So attention matters. Research tells us too that kids with ADHD receive a much higher density of negative attention. Negative to positive. That's not necessarily, when I say negative attention, I don't mean yelling, like angry, kind of like arguments, those types of things. But it's anything that's a correction, a redirection, a redirect, a prompt, any type of negative attention. Oop, stop doing that. Or, oh, think about that again. Oh, you didn't start this. Oh, you forgot your toothbrush. Did you brush your teeth? Did you brush your teeth? The more times that I ask that, the more attention, that can feel negative toward a child as we're giving those prompts and reminders. So again, kids with ADHD have a much higher overall density of this negative attention and feedback. The attention principle is really simple. What you pay attention to increases. Doesn't make any difference what it is. So this could be a behavior that I want to see, that I think is fantastic, that you did a great job of being responsible, coming home and unpacking your stuff, and then kind of getting ready to do homework, which is amazing. So I could put a lot of attention on that, and I think that that would increase. So I think the more that I paid attention to that, the increases the likelihood that my child's going to do that the next day. The same thing is true with negative behavior. So the more time that I spend arguing, debating, reminding, yelling about something, I'm also likely to increase that negative behavior. So if you were arguing with me and saying, I don't want to do this, I hate homework, I don't want to do this, and I'm continuing to say, well, you have to do it, you don't have a choice, and we're in this on and on debate, what I'm actually doing is I'm reinforcing and I'm giving attention to this negative refusal, this argument. And so unwittingly, I think parents, without really understanding, again, this principle, you get caught in a lot of those negative attention cycles that end up delivering a lot more negative attention and kind of getting you stuck in some of those challenging behavioral patterns like arguments and tantrums and those types of things, because you're not necessarily aware of this principle. Again, this if it was up to me, I'd probably teach this as a part of initial parenting of preschoolers, so that everybody would really have a firm foundation in some of these techniques. Honestly, I think it's really helpful and gives you kind of a leg up when we think about how do we really kind of engage in some of these behavior management principles, because sometimes it's different than what you would really think to do in the first place. Any behavior that I pay attention to is going to increase, whether it's positive or negative. And so that serves as the basis and kind of the backdrop of all the things that we're going to talk about this evening. I'll pause now really quickly before we kind of think about specific techniques. Any questions that have come up so far? Looks like no. Okay. So let's think a little bit about special time. So why do we want to do special time? We really want to help to reset this balance between positive to negative attention. So we want to give kids a time every day that they can count on, and parents a time every day that they can count on. That's going to be fun. That's going to be enjoyable. That's going to be time well spent to get to know each other, to build this relationship, and to build success. It helps parents really attend to positive child behaviors instead of focusing on negative. So kids really like special time. It's what they want to do. We're going to talk about kind of what the do's of special time are. What do you do during this time? But it's child-directed, one-on-one attention that kids enjoy. And so the behaviors that they're showing you during this time are creative and fun and imaginative and tons of great stuff that you can praise. The density of positive reinforcement should always be greater than the negative. So this ensures that you're kind of putting that time in a systematic way each day to help you really counteract some of this negative, right? Again, kids could have had a negative day of kind of negative attention at school, right? And then they, have a bus ride or something that's also really stressful. We want to make sure that we have some positive attention that's kind of systematic and strategic each day. It improves relationships between parents and kids. This is parents and kids of all ages. So I would argue that actually teenagers probably need special time as well. Now, they're not going to tell you that they like it and want to play Legos like younger kids are, or play Uno or something like that. But I would argue that teenagers actually need this time as well. So they need a little bit of daily download time. It looks different, and it's talking and connecting. But I think it certainly continues to improve that relationship and communication for teenagers as well. Systematically, it provides positive attention. So even when kids have a terrible day, right, like I always think about kind of Alexander's terrible, horrible, no good, very bad day. So you have this terrible day and all of this negative behavior. I would argue that special time is actually more important on that day because of the density of negative attention. And it can help to serve as a reset button for like, okay, that's done. Let's have this kind of positive time, and then let's move on with the day. So special time is not contingent on positive behavior. So this is not something that's taken away as a consequence. It's not something that you do just because kids have shown you good behavior. It's something that you think about like breakfast, lunch, and dinner. So if I'm going to take you to school every day, if I'm going to feed you breakfast, special time is kind of included in that. It provides an opportunity for you to see these consistent positive behaviors on a regular basis. And so sometimes, right, we don't get the opportunity to see our best sample of kids' behavior. And this provides you more of that opportunity. And it can help to offset this difficult behavior, which we talked about a little bit too. So this unsuccessful behavior at school or at daycare can really help to serve as a reset button. So what should we do in special time? So this is a daily one-on-one interaction between parents and children for about 5 to 15 minutes. So there are 3 parenting-based interventions for ADHD, 3 that have had 25 plus years of research. One of them says 5 minutes, one of them says 10, and one of them says 15. So what does that tell me? There's nothing functionally different between 5 and 15. It's that you need to put the time in for the small duration to really get the results and the payoff. So again, more is not better. It's the quality of the time. It's what you're doing during this time that really helps kids to feel that like attention, that positivity, that love, that caring, right? The things that really help you to build that relationship. It's actually really difficult to continue to do these things at that high level outside of special time. So I have training in all of these actually parenting-based interventions for ADHD, but some of them are pretty different from each other. One of them is called parent-child interaction therapy, which coaches, right, these 5-minute special time interactions. But 5 minutes, it's really hard to think about 5 minutes a day making such a big difference. And it's amazing the difference that that can have. I'm less structured about what you do at the time. It's more what your attention is doing, right? So for me, everything comes back to that attention principle. What am I doing in this time to create that positive experience and focus on those positive behaviors? So it's one-on-one time with a parent. Each parent is optimal, right? Or each caregiver. This works with grandparents just as well as it works with parents. It works with, aunts and uncles or other caregivers as well. Anybody who's in kind of like a primary child care role. I actually use this with summer babysitters as well. So if you've got a consistent summer babysitter or a nanny, it's an excellent way to incorporate that positive time and be on the same page in terms of strategies. So one-on-one is best. It's not necessarily required, but one-on-one time is best. So in this time, we want you to focus on letting the child select the activity. So children get to be in charge of very little, honestly. So I mean, maybe, right, they get to be in charge of what they get to wear each day, but maybe not, right? So if you have a uniform, you have pretty limited options. Breakfast, maybe, but maybe not, because we have limited options. And so really letting the child select what they want to do. They pick what you're going to do and you follow their lead for this time. So they get to be in charge of special time. So younger kids, particularly your 8 and unders, love being in charge of this time to say like, okay, and some kids really take this seriously, plan out scenarios and set up tons of fabulous little Lego structures and other things that they really want you to kind of hit the ground running, so to speak, which is amazing. Oh, I see a question come in, so let me take that real quick. Can you switch who does special time each day? Okay, great question, right? Alternate parents, or is it better to keep it consistent? What a great question. So I'm happy that you asked that. And this is the perfect time to think about that. So to optimize the benefits of special time for both parents, you would want each parent to do it. And oftentimes parents will kind of trade off. Sometimes that's not necessarily possible, either because of work schedules, because of co-parenting schedules, all those things. And again, we can be flexible. It's just who has the time, like who kind of has your child that day, and who has the time to dedicate to special time. And so if schedules are kind of competing or there's not necessarily that consistent time, then you'll want to think about who's going to kind of do the time and then talk about that with kids. That's the other really important part of special time, is that you want to let kids know that this is what we're doing, right? We're going to have daily like mommy time, right? That's going to be fun, that you're going to get to pick what we do, because I think we just sometimes forget about having fun around this house. We got lots of stuff to do, but I would love to spend a little time each day playing with you and having fun and being silly and being relaxed. And I think that's going to really help our family, so that you want kids to know that you're going to do this. This is a very intentional strategy. The other thing that does is kids remind you of that. And so, to your point and question about being consistent is really important. So even if it's not the same person every day, but having a consistent schedule where you're putting this time in and kind of dedicating the time is really the most important. It's why I'm actually less structured. So the other two kind of parent training models, aside from parent-child interaction therapy, advocate for a broader kind of definition of special time, right? That can kind of include other children, right? Because sometimes you have a baby and you can't do anything about when you need to feed the baby, right? But what I can do is I control my attention during that time. So I might be feeding a baby, but I might be paying attention to you. Wow, what an amazing idea. I love it when you show me how to do that. Oh my gosh, look how excited, right, your brother is when he hears, right, this information. I can give that other child still a very good amount of attention. And so sometimes you can share it. So let the child pick the activity. You also want to focus on labeled praise. So during this time, you want to be describing and praising and really kind of playing up all of this positive attention. Wow, what a great idea. Oh, I love how you stayed really calm. It must have taken you so long to do this. That's amazing. You put so much effort into setting this up. Great job. Descriptive commenting. Sometimes I think about that as an announcer for golf. So I know the Masters was this weekend, which is a very exciting, right, golfing event. I happen to find golf announcers to be some of the most amazing, right, like sports announcers, because I feel like they're describing scenery a lot of times and very like things that I would have to spend a lot of effort trying to figure out how to describe. And I think they're amazing. So I oftentimes think about golf commentators when I think about descriptive commenting, because I think they really have to be so mindful of like the whole environment, right, and incorporating that in. I'm reflecting. So what the child's saying, I'm kind of reflecting back and I'm saying, wow, I heard you say that you really love it, right, when we get to do this time together. That's awesome. Me too. So I'm really helping them to see that I'm paying attention to them. I can imitate them. So with younger kids, right, if they're building something, then I can build something along with them that looks pretty similar. I can be enthusiastic and excited about this time. Sometimes, right, special time also feels like work. And so I think enthusiasm is something that grows sometimes over time as well. So that the more that you practice this, the more reinforcing it is as well. Picking creative, imaginative activities is best. And again, we want to describe special time to children. So sometimes kids that are really competitive, games are not a great idea. So games have a winner and a loser. And I have to be honest, I'm like not a fan of kind of willy-nilly game rules, right? So it's like, I want you to play Uno, how we should play Uno, so that if you play with your friends, that we're all kind of on the same page. And so you just want to make sure that you're picking activities that are conducive to your child's temperament. And again, these can be different for every child, but usually creative kind of imaginary things are best. Other thoughts or questions about special time? Okay. So now we're going to shift and think a little bit about routines. So that firm foundation should include special time. So that time in each day, I think the best, most rewarding 5 minutes and the most bang for your buck is an overall parenting skill. Again, I would teach that universally to all parents of toddlers and continue that throughout life. The second thing that we're going to think about is we talked about how do we kind of be proactive and kind of smart about different strategies that we're using. Think about these day-to-day routines. So all of us probably have a specific morning routine. If we reflect a little bit as parents on our specific morning routine, right? So I do have a specific morning routine, right? I come down, I do things in kind of a certain order because it's kind of what I like to do in the morning, right? And it's what I find relaxing. It's how I kind of get started with the day. All of you probably have those things as well. We also probably have important routines. What are the routines that are the most meaningful for certain things, right? So maybe the way that I incorporate kind of exercise into my day is a really important routine because I know that that sets the stage for, you know, the rest of the work day. Maybe the going to bed routine is the most important because I need to do this kind of in the same way to help myself really get optimized sleep. So all of us have kind of important routines as well. This is not different for kids. You know, how are these helpful to us? They help us to get organized for the day, to give us natural prompts and cues about what's going to come next. They help us to calm down, right, if we might be stressed. They help us to predict what's coming next and kind of prepare for that transition. A note on COVID, I think what we learned, if anything from COVID, was that predictability routines are important for all of us. So all of a sudden, right, overnight, all of our routines changed drastically. And it was really hard, particularly for people who liked a lot of structure and predictability. It was really, really challenging to figure out what to do. So if we learned anything, having that schedule, structure, and predictability really helped us in ways that we didn't necessarily even anticipate. And so that's not any different for kids. And so when we think about this particularly, so all kids really benefit from structured routine. When we think about this for kids with ADHD, it helps them in a lot of different ways. So it works against some of the symptoms of ADHD. So having a consistent routine is going to predict that you do things in a certain order each day. And it's going to make it less likely that you're going to be forgetful in that day-to-day routine because it's the same every single day. And if I reward that and reinforce that and put a visual schedule up, I bet that they're going to remember that a little bit better and have that reference point, right? That we could shape that behavior a lot more successfully. So we're going to really think about these routines a little bit. The more that I also have a consistent and solid routine, it's going to help me to have to do less kind of parenting in other areas, so to speak. So I'm going to have to give less commands. I'm going to have to probably get into less like discussions and debates about things. It's like when you come home, you unpack. That's kind of what we do. And this is what, you know, that's kind of the expectation that we have. And so it avoids a lot of the overtime, right, as you shape these routines and behaviors, it avoids a lot of these natural kind of trigger points or challenges. And it just makes them a part of the expected day. So the benefits of schedules and routines, make sure that everybody's on the same page, so that you're having the same master plan. And that could be different on different days for different parents, right? But we're communicating that, or we're kind of all in agreement about here are the same base elements that we do each day. It does allow time for kind of collaboration on fun time. So I always want kids, as I'm kind of talking a little bit about the schedule or reviewing it, what are the fun activities that they have to look forward to during the day or the week, right? So you want to put things like special time on there, right? So we're going to do special time after dinner. They can anticipate that and they can get excited about that. They know when they're going to have that one-on-one time, which over time actually causes them to vie for your attention and kind of really beg for attention in negative ways. It allows awareness over day-to-day must-do. So what are the things that you really need kids to do every day? What are these non-negotiable activities, right, for parents? So, right, you need to get to work by a certain time, right? That's kind of the hard line that we need to get out of the house. What are the must-dos for kids so that you have to do homework, right? You got to brush your teeth, some of those things. So putting those on a routine can help them to see, like, these are the things that I really need to be responsible for each day. It can ease transitions for sure. So you know that, like, when you do these things, then kind of up next is, you know, school, or up next is bedtime. It certainly helps to keep your bedtime and wake up routines consistent to allow better mastery and independence, right? So thinking about like doing those same things kind of in the same order can really help kids to master those schedules. And again, works against some of that forgetfulness. It sets clear expectations, again, aids in remembering these daily routines, again, decreasing forgetfulness, which we talked about. And it decreases commands, which helps to increase compliance. So the more commands that I give to a child, if I say, brush your teeth, I need you to go brush your teeth, get your clothes on, get your shoes on, get your backpack on. If I have a list that says those things and I refer back to it, say, check your list, come back and see me, right? How many of those things did you do? All right, then come back and see me. So the amount of commands that I'm giving sometimes predicts how likely the kids are to comply. Like kids just kind of get stuck and don't want to do a certain number of things if they keep hearing, right, compliance requests and demands all the time. So it can really help to increase compliance because these are just kind of things that we do in a certain order and they're more routine. I don't have to really waste my time kind of giving commands on them, so to speak. So let's think a little bit about differential reinforcement. So the first part of differential reinforcement is praise. And so we're just going to talk about one kind of praise because I think it's really helpful. So we're going to think about labeled praise. So labeled praise is praise that teaches a skill and has an enormously better impact than good job, which is kind of general praise, right? That's great. I love it when people tell me good job or thanks. They appreciate that. It's awesome. I really love it more when people say thanks for, right, that example today. That really, helped, that really hit home for me. Because what that does is tell me, oh, I did something that was pretty helpful and I should do something like that again. So it teaches me that that's a more helpful thing to do. It's a behavior that people would like to see me do again. So labeled praise teaches and reinforces skills. So not just good job, but good job staying in your seat at dinner and being very specific about what behavior it is that you want to see more. Targeting specific behaviors with praise will increase them. If I didn't teach you anything else, if you picked up nothing else from this talk this evening, praising will change behavior, 100%. I'm confident about that. Very cool, right? So it's predictable, it's easy to use, it's free, and it has an enormously high impact on behaviors. And we want to think a little bit about this idea of targeting a positive opposite. And so when I'm going to praise a specific behavior, I don't want to say, good job not having a tantrum, which is, right, something that we could say, like, but what I'd like to say is good job staying calm, or good job, right, taking a deep breath before you came down and share that information with me. Good job, right? Like staying focused on your homework so that you could get this done a lot more quickly. Nice work. So some other ways to deliver effective praise that we want to think about. We talked about labeled praise for sure. This other idea is proximal praise. So giving praise that's close in proximity to the child that you're talking to. So sometimes if we yell from the other room and say, great job, they might not even hear us or say, hey, nice job, remember to hang up your backpack. But if I'm not in the room with my child with ADHD in particular, I am not going to know whether they heard that or not, right? So it essentially doesn't count. So proximal means being close in space to the child. It also means that you can use it in combination with other kids. So if I give one child, let's say I'm sitting at the dinner table with 3 kids. So I'm sitting at the dinner table and I say, hey, nice job, right? Sitting at the table so straight. We really love it when you do that. That helps us have a nice dinner. I can guarantee you, because I gave that labeled praise close in proximity to that child, but other children, the other kids are going to sit up a little bit straighter too, and they're going to be, what about me? What about me, Mom? What am I doing? Am I doing a good job? Yes, and that tells us that it's working. So proximal praise is super effective in sibling groups and in classrooms for sure. Praise should be 100% positive. So one of the things that I always talk with parents about is if you're delivering a praise, you don't want to ever use the word but. So if I said, great job hanging up your backpack, but I wish you did this every day, not an effective praise statement. I should have stopped at the but. I got to cut myself off. So I have to say, nice job hanging up your backpack. I might think to myself, I really hope you do this every day, but I don't want to say that. So I want to be 100% positive in what I'm delivering to the child. The density of praise to a correction or redirection should be 5 to 1. So I should have 5 kind of like positive praise statements for every 1 kind of correction and redirection. That's a tough ratio. I appreciate that. And so I'm throwing that out there so that we can be mindful about this density. When we think about how much negative feedback that kids with ADHD get and what this ratio looks like, it's really skewed oftentimes, again, for kids with ADHD, just with the amount that we're correcting and redirecting certain behaviors. The other idea that I'll mention about praise is having kind of a public celebration. So if somebody does something great for the first time, really helped out with something, was really independent, the more that you can celebrate that in kind of a public way, so that's either at the dinner table to kind of call that out and say, hey, right, so-and-so did an awesome job, right, like unpacking and getting their stuff ready, and even, right, like cleaned up their sister stuff today. That was so amazingly helpful. We really appreciate, your good work for the family or whatever that is. But I'm doing that at the dinner table in front of other kids. I might call a grandparent and say, hey, guess what? Right? Johnny read for 15 minutes on his own without even being told today. He remembered to do it all on his own, and it's amazing. We just wanted to let you know. Aren't you so proud of them? So the public celebration can really put an exclamation point on a lot of these behaviors that you're hoping to praise. Any questions about praise before we think about ignoring a little bit? This is the other side. So if I'm delivering positive praise and I'm delivering kind of this positive attention, the other side of this is I'm going to systematically target behaviors that I want to decrease attention on. So they're really good fits for ignoring. Ignoring is one of the most effective skills to use for many, many different types of like behaviors and situations, both for kids and parents. It's the most difficult skill to teach to anybody. Really, it is the most challenging skill because it feels like you're not doing anything, which is very, very hard, or it feels like you start using it and you kind of ignore until it escalates to a certain point or until it pushes your button. And so it's really difficult to ignore successfully. So what characterizes effective ignoring? So again, if we know that negative attention kind of builds behavior too, then we want to think about how we're delivering attention in that negative way and being a little bit more strategic. So selecting a good fit behavior is really important. So this is great for complaining, whining, attempts to argue, irritating noises. So like tapping, I could tap like this and it would be really annoying in the background of the presentation, but you might not choose to point that out to me if I have other things that are more important that I want to choose. Perhaps talking back. So if their child's quick response is no, I use this example a lot when I'm thinking about ADHD. So you oftentimes get that really impulsive response. It's like, okay, I need you to do your homework. No, but then they get up and they start to do it. So they've got that impulsive verbal response, but their behavior shows you that they're actually moving toward it. Then I would ignore that initial response and see, are they starting to move to doing this pretty quickly? Inappropriate behavior and timeout. So this is a really big one. So to be effective at actually using timeout, you have to ignore behavior, again, not dangerous behavior. So behaviors that not harmful. But I once had a child who made very creative songs in timeout that were about like, how much they disliked all of us who were sitting there. This was when I was coaching in parent-child interaction therapy. They made up a very creative song. It was actually, they had a lovely voice as well. And it was hard to ignore because they were really wanting to get a reaction. But I would ignore that behavior because what are they doing? To try and get me to pay attention and to get them out of that like timeout scenario, right? That's what that behavior is. The reason it's really hard is that kids kind of push your buttons. So they pick things that they know are going to be upsetting so that if they quickly respond like that, they know that you're going to engage with them. What that does, if I do that, let's think about homework. So let's say if I said, hey, I need you to do your homework, and you said no. And I said, well, don't argue with me. I need you to get started. Well, I'm not going to. And I get engaged in this negative attention back and forth. What happens is I've delayed the onset of homework by probably a significant amount of time by the time that I'm done. And or I might even give up on it if it's that difficult. This skill really requires parents to pick their battles too. So it forces parents to choose between strategies to address the behavior effectively and really kind of think about what skill and strategy I'm going to use. So am I going to use praise? Am I going to use a reward plan? Am I going to use ignoring? What am I going to do to really kind of choose the best strategy in this situation? So if I feel like I could praise when I see the positive behavior, then I might ignore some of these negative behaviors. If I could, if I'm tapping here and I could just praise like, thank you so much, right, for sitting quietly at the table, then I don't have to say anything about the tapping. Even if it drives me a little bit crazy in the short term, I don't have to say anything about that. Any thoughts or questions about ignoring? No? Okay. So rewards and incentive programs. So I know that everybody has used a reward program in some form or fashion. If you have children, you have definitely used a reward program. If you have kids that are potty trained, that's usually the most common first time that parents use reward programs. But we're going to think about rewards a little bit differently when we talk about ADHD. So that target behaviors need to be really specific and measurable and attainable. So I need to set a behavior that my child can do. So if my child is not compliant and remembering their daily morning routine at all, and I say, I've made a great checklist that's really pretty, and I say, I need you to do these 6 things and then come down and then you can earn a reward. If they have never done any of those 6 things on their own, I'm setting the expectation a little bit too high, right? So I'm going to need them to get started, right? So to get up, maybe the first part of that routine and then to the next part of that routine. And I might have to reward and shape those pieces. That's just an example, right? So most kids are probably doing some of those things, right? And moving through that routine pretty well, but I need to be very specific and make sure that they can attain them. And I need to know if this is a yes or a no. So if you're going to do a good job and you're going to get a reward, it needs to be really clear to me that you've met the goal. Part of the challenge with reward programs, I think, is that sometimes you have a lot of what's called gray area in trying to define this. And so kids might say, hey, I did that, but you would say, you didn't do it 100%. It's like, yeah, I did do that, or I was a good listener. How much was I a good listener? How many commands did I get? Who knows if I met that criteria or not? So oftentimes it's defining the target behavior where reward plans really start to kind of fall apart a little bit before I would argue that they even get started. So to make rewards sufficiently kind of like motivating for kids, like, so for a reward to really work, it has to be something that a kid wants and something that they're going to enjoy. So usually this involves kind of a combination of short-term rewards or immediate rewards to kind of create that behavior change. So definitely for kids 8 and under, I'm thinking about what I could do really short-term, daily, or even immediate to kind of reinforce these particular behaviors. Because they're not necessarily going to remember from the morning to the evening what they did to kind of earn a particular reward or delay reinforcement that much. Longer rewards, longer term rewards reinforce kind of usage for practice of skills. So when I think about kind of building up to like the end of the week where you can kind of get an ice cream, that's something that I would think is a reinforcer for 5, let's say 3 out of 5 days of following your morning checklist. You can get this reward at the end of the week. So it helps to reinforce consistency in meeting the goal and practicing and reinforcing the skills day to day. So long-term rewards are not necessarily effective for ADHD as we're trying to build those behaviors day to day, right? So if I'm thinking about for an 8-year-old and I need you to do this morning routine until the end of the week where you get a reward, that's too much. I don't think that that reward plan will be successful. Not because reward plans don't work, but because I'm setting the goal too high and I'm setting the target reward too far away. So you need to have kind of the right mix of these. Low, no-cost rewards are best, so it has to be something that's sufficiently motivating. One of the best things to use actually as a reinforcer, so if you start to use special time, is being able to use bonus minutes of special time, right? So maybe 5 minutes is what you get as special time in your house. But if you do a great job with your morning routine, you get a bonus, 5 minutes or something like that, let's say. So kids could be really excited and motivated about that, and it would cost me nothing, right, other than my time. The other important thing to remember is that we want rewards to kind of be phased out over time after mastery is achieved. One of the other challenges with reward programs is that we usually abandon them before you get mastery on a behavior, so that we might use a checklist for a week. If it doesn't necessarily change, we might abandon the checklist. And so to really master a skill, meaning to do something every single time, predictably, right, at 75% or greater, I don't actually make mastery 100 because none of us actually do things 100% of the time. So mastery is equivalent to 4 weeks of getting this goal at 75% or greater. That tells me that I'm doing this the large majority of the time, and even higher than that, right? So 75% or greater, but I'm doing this the large majority of the time each day for about a month. I know that seems like a long time. So then, right, you would start to kind of change the reward or increase the criteria, especially as you're starting. You want to kind of aim a little bit lower in this situation to make sure, right, that you can kind of build this positive plan and get some incentives and motivation for some of these behaviors. One of the other challenges with reward programs is that oftentimes they're used as both a reward and a consequence. So you read a lot about token economy. So Russell Barkley, who's my favorite ADHD researcher, in his ADHD treatment program, he talks about actually using a reward plan that's called response cost. So you do something, you earn a reward, and then you do something that takes away a certain reward. He would say very clearly that you do not confuse rewards and consequences for a certain period of time. And that response cost programs like that are for older kids. So they can be really confusing, especially if you actually, if math is not your strong suit. Like younger kids actually can't add and do this exchange to make those successful really at all. So you need to be about 8 years old or older to then kind of even think about doing something like that. But you would establish it as purely a reward program for a number of weeks before you would ever use it as kind of a consequence where you take away points or you take away chips, right? So oftentimes parents will start kind of giving, let's say, cotton balls or giving kind of puff balls and taking them away at the same time, which is a little bit confusing. So you want to establish it as a reward first. And we're going to handle other things like aggression or destruction of property or other kind of like challenging behaviors. We're going to handle those with a consequence. So reward programs have to respond to the changing interests and needs of kids. So what we know about ADHD is that it's consistently inconsistent. I can predict for sure that ADHD is going to be inconsistent over time. So that simple systems are often the most effective to get this high return on your investment. And then they're going to change, right? Kids are going to get bored with a certain reward, and I'm going to have to change those out. So a menu can be really helpful. Older children often transition from a more immediate reward to a longer term reward. So if we're thinking about that kind of middle school, late elementary school to middle school to high school, for sure, you might be able to have a long reward plan, right? So if I'm working on kind of car privileges, right, or, you know, earning money to kind of go out on, you know, a date or something on the weekend, then I might be able to do behavior all week, right? Because that's a high enough, you know, goal. Rewards change as kids age, so you turn more to kind of granting privileges than kind of rewards in a traditional sense, or like monetary kind of investment, right? That you earn, you know, kind of gas, right, in your car or other things if you kind of get these things accomplished. The key to success is consistency and strategic use. So you want to use these strategies on purpose to really get change in target behaviors and use them consistently to find success. Any questions about rewards before we round it out with some timeout basics and consequences? We'll talk about privilege removal too, but a little bit of consequences. No? Okay. So timeout basics. So the strategy that we want to think about for kids, for sure, 8 and under, right? But again, kind of 8 to 10, you can be flexible based on your child's kind of developmental age and ability level, whether you're still considered timeout as kind of your primary go-to. So just some thoughts about kind of what we kind of know about timeout and what makes it effective. So we would like sometimes to think as parents that going to timeout and being quiet in timeout helps kids to reflect about their behavior. That does not happen for most kids. And I can certainly guarantee that that does not happen for most kids with ADHD. So what we know about timeout is that it's effective because it removes all of your opportunity for something that would be reinforcement. So that timeout is best in kind of like if I'm thinking about this idea of spot selection in a dull, boring place. So you can have a spot on the floor, you can have like hallways are actually really pretty boring and there's not a lot to do there. You can kind of like flail around even and not mess up anything in a hallway. But it removes the opportunity for any kind of like positive attention or reinforcement. And so bedrooms, again, sometimes I put that on there. Some kids, right, don't like being in their bedroom necessarily or find it reinforcing. Some kids, it's like a mecca of like awesomeness in your bedroom. So I might not mind, right, going up for a 10-minute timeout because I think it's pretty cool in there. So you're going to think about timeout as, again, the way that you're kind of removing this opportunity for reinforcement. And that's what really makes it effective. So it should be short and we should use it sparingly. So it should be a last resort. And so anything that I'm going to overuse in terms of a consequence is going to make it significantly less effective. So I'm going to use this for like my top tier type behaviors, right? So things like aggression, destruction of property, safety concerns, repeated noncompliance. So if you're debating, you know, a question and you're repeatedly not doing what I'm asking you to do, then I can also establish timeout as a consequence for that repeated noncompliance. Safety concerns would be, let's say, if you ran out into the street after a ball, safety concern, that would be an immediate timeout, right? I need to send a clear message that this is an unsafe behavior. 5-minute maximum really helps timeout to be more effective. So nothing over 5 minutes has shown to be any more effective. I know you hear this old, you know, rule of a minute per year of age. That's really only true up until age 5. So sometimes, right, you can add minutes, right? There's one of the evidence-based parenting curriculums that encourages you to add minutes kind of up to 10 as a warning to kind of go to timeout, right? So for slightly older kids, it's like, so I'm going to add a minute, right? If you're not there, right, in the next, you know, 5 seconds or 10 seconds or something like that. So you can add minutes to kind of have motivation, but nothing more than 5 minutes has shown to be more effective because we want to make it brief, purposeful, and targeted. And then we want you to actually go back to things that are enjoyable. So like when you're coming out of timeout, I want you to go back to doing what you were doing before and have a chance pretty quickly for me to praise you, catch you being good, and show that you can kind of manage this activity and be successful. So if you, let's say, hit your sister and you go back and you say that you're sorry and you share a toy, I would say, awesome job, right? Being a great big brother or big sister, nice work. So I want to keep that time brief so that I maximize my opportunity for kids to get back into the mix, so to speak, and kind of get that positive attention. So the other thing that we think about in terms of consequences for older kids, so I think about this over age 8 mostly, just because your 8-year-olds can really start to kind of understand time a little bit better, right? So younger kids really don't understand the concept of time. And again, some 8-year-olds don't either. So I say kind of this flexible 8 to 10-year-old rule. But the other consequence that's typically used that we think about is privilege removal. So again, we want to use this sparingly. So just like I use timeout, right, for younger kids, I'm not going to use privilege removal for every little thing, right? If you talked back, if you didn't do your homework, if you didn't unpack, if you didn't get dressed on time, if I use kind of privilege removal for all of those things, kids are not necessarily going to know like what's the priority, right? That it's just that you lose it for all of these different things, which is not a good thing, but it doesn't necessarily help to reinforce some of the behaviors that we want to see more of. So we should still use this for aggression, destruction of property, safety concerns, repeated noncompliance. And kids should know what they're going to get timeout or privilege removal for, right? So it's like, if you don't do X, then this happens. It should be predictable. So this behavior gets this particular consequence so that everybody's on the same page and you're not necessarily having to use it, let's say, on the fly, right? Safety concerns are really the only category that might be on the fly because you don't know how to anticipate if you're going to be in a safety scenario necessarily. But everything else should be pretty predictable. Brief periods of time that you're removing the privilege is also best. And so if you're going to lose the iPad, then I'm going to lose the iPad for that evening. I have an opportunity to earn it back tomorrow. The reason for that is a really simple one. So if I lose it for a long period of time, I also lose the opportunity to use that as a reward. So the likelihood that you're going to have more challenging days, so if the iPad time is what's earned for doing your morning routine and I take your iPad away for 5 days, I really decrease the likelihood that you're going to cooperate in the morning overall, if that's kind of my most powerful motivator. So I want to send the message that this behavior is not appropriate, but I want to give you an opportunity to earn that privilege back then as soon as possible. This can be used as a backup to timeout, right? So if you have a child that really doesn't want to go to timeout or refuses, then privilege removal could be used as a backup. So it's like, if you're not going to, right, kind of choose to go to timeout, right, then you get this much time or you get this many mornings, and then, right, we'll lose the iPad for the day. So it can be an effective backup method as well. So engaging the school, as Dr. Williams said at the beginning, so Pilot and I have been working together all year about thinking about these strategies. So again, the same strategies work. We know that the same things that we're talking about tonight in terms of parent behavior management work in classroom behavior management as well. And the same way that we're thinking about defining specific goals and communicating and being on the same page work between parents and schools just as much as they work between parents and kids or between teachers and kids. So I want you to think about what are the specific goals that kids need to work on at school, right? So as a parent, you can think about that too, right? And then that's what you can use some of the time for school conferences and those types of things. Using a daily teacher report card to track behaviors can be really helpful. So how well did your child complete work in their class that might be the hardest class for them? And you can track that each day, and you can provide a very specific reward, right, or response for that at home to really reinforce that effort and attainment of goals that you see at school. It can help the school, right, to be more effective by creating these plans on your own. So I always say to parents when I'm thinking about ADHD that educating yourself as a parent about what is ADHD, what is effective treatment, how do I understand and kind of manage through these situations at home can be really effective as I try to share that information with teachers. So not putting the expectation that teachers are going to understand ADHD and your child the best, right? So understanding ADHD is a part of, right, what we've been working on at least, at Pilot this year, but understanding how your child responds to those strategies is really what I'm the best at as a parent, right? So I know my kid best, and I'm going to know how they're going to respond in this situation. And so my responsibility as a parent is to really share that information and be open with the school. Here are some things that we've tried at home, and here's kind of what we see. What do you think could work in the classroom? How can we work together to kind of create a plan that's going to be most effective? And keep them in the loop, right? So if something changes, if you have something that they did that was a great success at home that relates to, homework or independent reading, share that with the school, right? Share these positive successes. Keep them in the loop about a strategy that you found. It's like, hey, this was super effective. We didn't know that it was going to be as effective as it was, but it's been amazing. And so, right, if you get a chance to use that at school, that might be really helpful. So really making sure that you're on, again, that same team and working together toward these kind of common goals of success for children. So now we'll end with some resources. So chad.org is one of my favorite resources to mention for parents. I don't know if parents are aware of this resource or not, but it's run by the National Resource Center on ADHD, and it's a parenting organization for parents of kids with ADHD. And so it really helps to provide lots of evidence-based information about ADHD in lots of different situations. So check it out if you haven't before. They're also fantastic at putting out quick fact sheets. If you read an article or there's something popular, like popular press or news kind of covers something specific, they do a great job about putting out a quick kind of fact sheet from experts about how to understand that or how to think about that. YouTube videos. So Russell Barkley is my favorite ADHD researcher, which I said already. So this Essentials, the 30 ideas that you should know about ADHD, are a big time investment, but a lifelong investment of learning related to ADHD. So I've had parents say when they watch this series, and it's, again, like the Essentials is like 2.5 hours. So this is not a short time commitment. But those who watch it are really impacted by the techniques, like the information that he's talking about related to ADHD, and then how they're kind of thinking about and organizing strategies to support kids. The 30 essential ideas is also like broken into smaller pieces, right? So not everybody has 2.5 hours. You can obviously chunk this up, but he's got lots of amazing resources out there that are free and available. The American Academy of Pediatrics puts out lots of great information about ADHD as well. I'm only recommending one book because there's so many books about ADHD out there that Taking Charge of ADHD is a great one. Easy read, high value techniques, and you can really kind of work through that. And I would think about it as kind of like a psychoeducational intervention. So you learn a lot about ADHD, but also about these techniques and how you would kind of start to implement them for kids with ADHD. Finally, effectivechildtherapy.org is a resource, a free resource by Division 53 of the American Psychological Association, which is the Child and Adolescent Division. And what it is geared toward parents and kids understanding how to think about effective child treatment and effective assessment of childhood disorders. And so it actually has a free assessment center where you can go and take kind of checklists related to different symptoms and different concerns that you might have about children to see like, okay, like here's what I have thought about my child in terms of these ADHD symptoms. So you might fill out the Vanderbilt, you might fill out a generalized anxiety questionnaire. And you can take that information to your healthcare provider to really make sure that you're on the same page about the symptoms that you're talking about and how be armed with more of that assessment data. And again, those are free and available. It also talks about what do we know about how to get effective treatment. And so how do you really work through making sure that you're getting effective resources from the providers that you have. So that's effective medication management, that's effective strategies related to behavior management, but it covers all childhood disorders and diagnoses. And now I'll open it up for questions. I know this was a lot of information, so I appreciate everybody hanging in there as we went through all of this together. It's a lot. I could probably give, right, behavior management presentations over a 6 to 8 hour day, right, and dive that much into them. So again, I appreciate you all listening. And so help me to understand if you have questions. How can we help this be more helpful for you? Oh, awesome. Thank you for the positive feedback and specific feedback. I appreciate that. Yes, absolutely. I'm glad you're enjoying it. I'm very picky, I'll say, about resources. I know that this list is like short and I know there are millions of books out there. But again, I want parents to really have a set of resources that are like your go-to resources, right? It's like I could Google ADHD and come up with 5 million hits about things that would be completely ineffective. And so really having some go-to resources, again, for childhood conditions overall, but specifically ADHD, I'm pretty passionate about. Yes, absolutely. Yeah, special time being the foundation. Thank you for that comment. It is. It's hard to remember that. And I think, again, we don't all keep up with special time 100% of the time, right? So I'm a parent as well, right? And I use and think about special time all the time. But it's hard to kind of incorporate that day to day all the time. And so I oftentimes think about like after you kind of get out. So I used to run a large group behavior management program. And what would happen sometimes is the parents would be awesome, like completers, like behavior would look pretty great in kind of like non-medicated times, or overall, again, for preschoolers, it looked pretty good. And then what would happen 4, 6, 8 months down the line is parents would come back and say, hey, like we need a booster. And we actually loved as group facilitators to provide these boosters because it was awesome, right? We had all the same language. We'd spent all this time together, 2 hours a week for 12 to 14 weeks. And what these things came down to most of the time was probably special time. It's like, so when's the last time that you did special time? They're like, oh yeah, right? Like I forgot about that. It's like there are 2 or 3 things that we really know are almost like that, again, kind of that like food that you need to kind of be successful and kind of maintain that healthy parenting relationship. And special time is really one of those. So the best 5 minutes, I think, that anybody can spend for sure.
Kimi, I'm not sure if you answered this or saw this, right as the comments were coming through, one participant asked if you recommended where to find parenting classes.
Oh, I did not see that. That's a great question. Where to find parenting classes? So really a good question. So what I would think about is if you're going to reach out to kind of local resources or agencies, I would ask for if they have any group kind of parent behavior management classes. And so a lot of the therapy organizations, so I used to work at Nemours as well. So I worked at Nationwide Children's Hospital in Ohio, and I worked at Nemours as well. Both of them had group parent behavior training programs. Oftentimes they have a pretty lengthy wait list. But again, I think also asking that question and reaching out helps them to know that they can kind of grow group capacity. And so they became actually a really popular offering. When I worked at Nationwide, we actually ran about 40 of these groups a year across 4 different behavioral health sites. So it was an enormous program. But again, parents really enjoyed that. So thinking about that again, right, you could reach out to any number of the organizations, right? Hockessin Center for Change, I also know, does some groups. There are a number of different local organizations that do parent behavior management groups for sure. So good question. Your pediatrician is also a good resource for this. So I will say that pediatricians work hard to collect resources to give out in these situations. And so pediatricians are oftentimes in a really good seat of knowledge for like, oh, I heard that this person like might have, you know, an opening in a group or that they just started a new group. I will also say that CHOP runs a large parent behavior management training program. So CHOP has a center for ADHD, and they offer parent behavior management programs in their satellite offices as well. So that's a big behavioral offering for them too. You're welcome. Awesome. Any other questions? And I'm always happy to answer questions as well. So sometimes people reach out to me and I'm happy to condense kind of resources from all of our local states to be able to send out as well. Any other final questions?
I'll jump in just to thank you again, Kimi, for coming, and looking forward to the final installment. And then we'll probably get started on our summer series, which will be
That's right.
around the corner. Yes,
that's right. Lots of good times to come.
Yes, absolutely. So thank you, and thank you to all the participants who came tonight. Everyone have a good night.
Yes, thank you, everyone. Take care.